You're listening to Civic from the San Francisco Public Press. On this edition, now that vaccine eligibility has expanded to everyone over 12, can employers, governments, and schools mandate COVID vaccination?
I used to say that I think if it goes to court, there's a 70 to 30% chance that the court will uphold the mandate. I think it's higher now. I think there's probably an 85% chance that the court will uphold employer mandates after the OLC decision and the previous court decision. Employers are taking a risk both ways. If employers don't mandate the vaccine and there's an outbreak of COVID in the workplace and an employee goes to workers' compensation because they got COVID on the job, the employer would probably have to pay. The vaccines aren't completely preventive of COVID, but they do reduce the risk.
I'm Laura Wennis, and this is Civic. With the Delta variant, coronavirus infections are on a sharp increase again in the Bay Area. Several regional municipalities issued a new mask mandate on Monday, although this interview was recorded on Friday, July 30th. And that mask mandate says everyone has to wear masks in public indoor spaces, regardless of vaccination status. And for a while now, health officials have been strongly recommending that everyone eligible get vaccinated. Some employers have made that mandatory. As of late June, San Francisco had issued a requirement that employees and new hires must be vaccinated once the available coronavirus vaccines, which currently have emergency use authorization, receive full FDA approval. California also recently announced that healthcare workers and state employees have to be vaccinated or get tested weekly and wear masks on the job, and that requirement is set to go into effect in late August. Already, there have been some attempts to challenge the legality of similar requirements on vaccines in other states. So we thought we'd talk with an expert on vaccine mandate law. Conveniently, there is such an expert in San Francisco. I'll let her introduce herself because she actually revealed something I didn't know about what she does right off the bat.
So my name is Dorit Reiss. I'm a professor of law in the University of California, Hastings College of the Law. I teach public health law, torts, administrative law, and other areas. And I also research vaccines in the law. I write about vaccines exemptions, vaccines and tort liability, other ways to increase vaccine rates. I write about the anti-vaccine movement and its efforts. And I'm also active on social media in responding to anti-vaccine misinformation.
Wow! I did not know that. Wow. What has that been like during the pandemic? My goodness.
It's interesting. So it's always been interesting because although the pandemic has brought vaccines much more into focus, the anti-vaccine movement has always been passionate. They feel very strongly about their beliefs and they're very anxious to spread the word about what they believe.
So what do you say in response when this is your specialty?
It depends what's going on. A lot of times the situation is either a pro-vaccine place posted a pro-vaccine post and anti-vaccine people come over to educate the ignorant, as I see it, or a general article on a news outlet addresses vaccines and anti-vaccine people come over. Sometimes in comment thread, you simply respond to claims as they are raised. And it can get tricky because, again, many of the anti-vaccine people passionately believe what they say. Some of them are coming in from a position of something bad happened to my child and I think it's because of vaccine. So they're coming in hurting, they're coming in angry. And the dialogue can become hard and the dialogue can become so adversarial that it's hard to remember that the other person is coming in from a position of pain, a position of anger, but you really need to keep that in mind. Other things I do is I try to write blog posts about myths, especially about myth about the law and vaccines. So, and then I use those as a shorthand to answer claims that repeat themselves.
Right. Well, this is actually an interesting opportunity just for me because I've spoken a lot with healthcare providers and community organizers about vaccines and vaccine access, and I've less so talked about this from a legal perspective. Are there any common misconceptions that you find yourself addressing over and over again from about the law?
There are. So I did not grow up in the United States, but people who grew up in the United States come in with the point of view of America is all about individual rights.
Right.
And the reality is that America has always been about balancing individual rights with regulation. even if we ignore, and we probably shouldn't, systemic injustices in our systems, etc., it's never been about only freedom. There's always been regulation in the public health and the public safety since the beginning of the Republic. A lot of people are surprised to know that the rights aren't as extensive as they may think, and that, yes, the state can regulate in the public good. That's one. The other thing, more specific to vaccines, more inside baseball, in vaccines in the United States is one of 19 countries that offer a no-fault compensation scheme for people harmed by vaccines.
What does that mean?
What it means is, so if you've been in a car accident, you may go to the tort system to sue the other person for compensation, or your insurance company at least will do that.
Right.
For vaccines, there are limits on doing that. You can't just go to the tort system and sue the manufacturer. You go to a special administrative program. It has the advantage of being a lot easier, so you can get compensation without showing, for example, that the other side did anything wrong. You just have to show that you took a vaccine, the vaccine caused your harm, and show your harm. So it has a lot of advantages for the plaintiff, but it does limit your ability to go to the tort system. Anti-vaccine people like to point to that and say this liability protection means that vaccines are unsafe because you can't sue the manufacturer. That's incorrect, because I teach torts. If we had to rely only on the tort system to increase safety, we would be in a lot of trouble. Car safety, for example, has largely grown up through regulation rather than tort liability. And we regulate vaccines a lot heavier, a lot more stringently than we regulate car manufacturing. And we have a lot more data about vaccine safety than we have about car safety, although we have a lot of data about car safety. Because there's this limit on going to the court system, vaccines are unsafe, is untrue, but it is a common claim.
Just to clarify for people who are not lawyers and do not have contact with the legal system almost ever, like myself, tort law is when somebody has been harmed by another party? Or what is this
Yes,
about?
Tort law is a civil set of law. It's not criminal.
Right.
It's a civil set of rules to compensate people for harms, both intentional harm. So someone punched you in the nose, you can sue them for money for the harm you suffered from that, and unintentional harm. A product caused you harm, a car accident, someone dug a hole in the sidewalk and didn't cover it and you fell into it.
Right.
All those things are things you'd go to the tort system to be compensated for.
All right, so I want to pivot to the thing that I originally wanted to ask you about before I learned this fascinating thing about the things that you do. Sure. Just to make this as straightforward and clear as possible, it is legal for an employer to mandate getting a coronavirus vaccine. Is that right?
It's a little more complicated.
You're like, it's not straightforward.
Yes, sorry.
Okay.
So the short answer is vaccine mandates by employers are generally legal. We have a long history of vaccine mandates. And hospitals, for example, mandate that employees get a set of vaccines, including annual influenza vaccine. Not all of them, but many do. And that's legal. In fact, there's an argument that the employer has an ethical duty to create a safe workplace. So if there's a real risk of getting a disease in the workplace, there's an argument that mandating vaccine that reduces that risk is the ethical thing to do. However, even before coronavirus vaccine, there were limits on that. And I'll mention 3 limits, and then I'll go to the additional problem for coronavirus vaccine.
Okay.
The first limit is if the workforce is unionized, many collective bargaining agreements would require the employer to negotiate with the union before mandating the vaccine. That's going to be specific to that employer and that collective bargaining agreement, but it's something you need to check first. Second, under the American with Disabilities Act, if someone has a medical reason not to get the vaccine, then the employer has to provide a reasonable accommodation unless it's a really, really high burden. So in the case of coronavirus vaccine, if someone has, let's say, an allergy that prevents getting vaccinated, the employer has to provide them an alternative. The employer doesn't have to treat them like everybody else. They can take measures to reduce the risk. But for example, they have to say vaccinate or test, vaccinate or mask, but they can't fire the person just because they have a disability and can't get vaccinated. The third limit that existed before coronavirus vaccine is if an employee has a sincere religious objection to the vaccine, the Civil Rights Act of 1964 prohibits discriminating on religion, and employers should accommodate such an employee, someone with sincere religious objection, but only if it's no more than minimal burden on the employer. It's a very low bar. If it's more than a minimal burden, you don't have to. Mm-hmm. There's a number of problems with those exceptions. For example, what's a sincere religious objection?
I was about to ask you that. Thank you.
It's really tricky to prove because, for example, some employers think maybe I'll only give this to employees who bring me a letter from a clergy person. Wrong. You can't do that. And you can't do that because that discriminates in favor of people from organized religion. And the protection is for the belief, not for the organized religion.
Right.
So there's only a few ways an employer can oversee sincerity. You can ask the employee to explain their beliefs. You can ask them to write a letter. You can ask them sometimes, if it's appropriate, to bring evidence from another person, but not a priest. You can't limit it to a priest. So give me some outside collaboration of this. You can do that sometimes, but you can't, for example, say, your belief sounds unreasonable, so I'm not believing you. You can't say, bring me a letter from your priest. And the way this works means that people who either are more sophisticated liars or have access to advisors that will teach them what to say probably do better than people who have exactly the same beliefs, but don't have the same access. There's actually a number of anti-vaccine people that are holding workshop on how to write and religious exemptions that will be accepted, and several lawyers that are willing to help people write their religious exemptions. So it's an area that's very vulnerable to abuse.
Mm-hmm. Well, same question for people who have medical reasons then. Do they need a note from a doctor or do they need some kind of proof that they actually can't get the vaccine?
Yes, medical reasons is actually more straightforward. You do need a letter from a doctor and you do need medical proof that you can't get the vaccine. But there's kind of an assumption that medical issues can be better objectively proven than religious belief.
Mm-hmm. Yeah.
So that's all, even before coronavirus vaccine. That's for any vaccine. For coronavirus vaccine, we have an extra problem, which is right now these vaccines are not licensed by the FDA.
Yes.
They're authorized under an emergency use authorization.
Yes.
And there's a legal question. Can you require vaccines that's under an emergency use authorization? And what makes it more complicated is that the act that allows the FDA to authorize vaccines for emergency use has a provision that says the Secretary of Health has to inform recipients that they can accept or refuse the vaccine and of any consequences. Mm-hmm. So people initially looked at that, and very respectable legal scholars looked at that. So did the CDC and FDA. And initially they said, if you inform people they can't accept or refuse the vaccine, there's no mandates. You can't mandate the vaccine.
Sorry. So if you inform people, if you tell people flat out, hey, this is under emergency use authorization, you can take it or leave it. You just have to deal with the consequences. One of those consequences cannot legally be that you lose your job.
So that's the question. So there's several pushbacks against that. The initial approach was you probably can't mandate this vaccine. But there's several pushback. One is exactly the point you're raising. If there can be consequences, maybe they can be that you lose your job. But the thing is, the Secretary of Health has to tell people about those consequences under the Act. And the EUA documents don't mention losing your job. One of the suggestions a colleague and I floated in the past week and a half is maybe the solution is for the FDA to change the EUA document to mention that this can be a consequence so that people will know going in. They haven't yet. Another argument against this interpretation that this means no mandate is the law only speaks to the Secretary of Health and Human Services. The law doesn't say anything to private employers, to universities, to states, even to other federal actors. Since we know that in the past employers could mandate vaccines, can we really read into this silence a big prohibition on every employer in the United States against this? Many people say, no, you can't read this into the law. It doesn't say this. And in the last week, the Office of Legal Counsel, who is the advisor to the president, came out with a memo that says exactly that. The memo isn't from last week, but it's been published this last week. Mm-hmm. And the Office of Legal Counsel, in a very thorough memo, said the law doesn't speak to anyone except the secretary, and it's just about the secretary informing recipients. And accept or refuse, just talk to what the medical provider can do. The person giving you the vaccine can't hold you down and give it to you. Mm-hmm. But it doesn't change the law outside that interaction of you and the person giving the vaccine. And this is not binding in court. The memo is an advisory memo, but it's so well written that it's probably going to be persuasive to courts. We also have one court decision on this issue, which is a Texas district court. A federal judge was asked whether a hospital can mandate the vaccine. Employees who didn't want to vaccinate sued against the mandate, and the judge said the EUA Act does not prohibit private employers from mandating the vaccine.
Ooh, this is complicated. Do we have a precedent for a vaccine in the U.S. that has been mandated for workers or school children that only had emergency use approval?
No, in fact, we never had a vaccine authorized for the whole population under emergency use approval. We're in completely new grounds. The only vaccine that was authorized under an emergency use authorization before is an anthrax vaccine for the military only. And that was a vaccine that was already licensed and just moved from some kinds of anthrax to inhaled anthrax, from anthrax contracted via the skin, etc., to inhaled anthrax. So this is really new ground. We never had a situation like this before.
Oh my gosh. Okay, so we don't know for sure if employers can legally mandate this vaccine. It seems like they might be able to, based on this opinion, but it is not set in stone.
Yeah, I used to say that I think if it goes to court, there's a 70 to 30% chance that the court will uphold the mandate. I think it's higher now. I think there's probably an 85% chance that the court will uphold employer mandates after the OLC decision and the previous court decision. But there's still a chance the courts will not. So employers are taking a risk. I will add one more thing, if this isn't complicated enough, that the employers are taking a risk both ways. If employers don't mandate the vaccine and there's an outbreak of COVID in the workplace and an employee goes to workers' compensation because they got COVID on the job and were seriously sick, the employer would probably have to pay. The vaccines aren't completely preventive of COVID, but they do reduce the risk. If, on the other hand, the employer mandates the vaccine and an employee has a severe adverse reaction, the employer would probably be liable under workers' compensation because it's a work condition as well.
So in other words, they can't win.
I mean, they have to weigh which is the bigger risk.
Right. Okay, that's probably a better way to put it. Acknowledging that this is kind of hypothetical. Sorry, I want to ask one other thing. So when you're talking about if courts uphold or don't uphold, or the likelihood that a court will uphold or not a mandate if it goes to court, that probably varies by court, right? Like it's not all going to be decided at the Supreme Court right away. It'll go to the local court first.
You're exactly right. It's going to... There's a chance that there will be there's a good chance there will be variation by court, and different judges will see it differently.
I'm speaking with Dorit Reiss, a law professor at UC Hastings who researches the law around vaccines and vaccine mandates. I want to ask hypothetical questions about how mandates would work if they are instated.
Please.
A mandate means that you have to do something, but that kind of only matters if there are consequences if you then don't do that thing. So what recourse do employers have to compel their employees to get vaccinated?
Good. So at the extreme end, it is legal, and that's what the Texas hospital did to say vaccinate or you're fired. Yeah. That's what I consider a hard mandate. Your choice is vaccinate or you don't work for me. That is legal, and that's what I was talking about when I walked you through the options, the legal limits. However, an employer can certainly also impose a softer mandate. That's what, if you've heard the governor of California and the governor of New York and the president talk about mandates for their state employees, the state and federal employees, that's what they're talking about. Vaccinate or test every week. That's also an option. Some hospitals before COVID had influenza mandates that were vaccinate or wear a mask the whole flu season.
Right.
And that's also a softer mandate, but a very reasonable option for an employer, because although testing isn't completely preventive, it's something, and it's a way to reduce the risk from that employee.
Yeah, reduce the risk. Sorry, go ahead.
Sorry, and it's less aggressive, so it might help you not lose valuable employees.
Right.
And it's may reduce litigation because an employee is less likely to sue if they can stay on the job.
Yep. Okay, what about kids in schools, especially in public schools? That seems ethically dicier because kicking a kid out of school for not getting vaccinated, particularly if, as with many families, it's the parents and not the kid making that decision, might actually be harmful to the kid.
Yes. So there's 3 parts to that.
Okay.
The first part is the vaccine isn't yet authorized for children under 12.
Yes. Which
is really frustrating to me. I have an 11-year-old and a 5-year-old and a 6-year-old. He's 6 now. They're not protected right now.
Right.
So these kids can't get the vaccine at all right now.
Yep.
I doubt we'll see school mandates until children over 5 can be vaccinated. I really doubt that because I think the political powers won't want to spend the capital. And it takes an effort to pass any vaccine mandate. And these are going to be challenged.
Right.
Controversial.
Right.
So I doubt they'll want to spend that capital twice to fight for over 12 and then again for 5 to 12. So I expect we won't see public school mandate until we have a vaccine that's authorized for children over 5.
Yeah.
And even then we might not. Private school can start requiring the vaccine for their 12 and up if they choose to. They're not state creatures and they don't have to wait on the state.
Mm-hmm.
But public schools probably won't. So that's one thing. The other thing is, as you're correctly saying, there's a question about here that we have parents making the decision, not the child. So there's several ways to go about it. One way is to empower children. For example, the city of San Francisco issued an order that children under 12 can get the vaccine without parental consent from a health department or a provider. So
they can?
Yes.
Huh.
So they're letting children make the decision. It's not unheard of. So all states have laws allowing children to consent to some things without parental consent. The classic things is things related to sexual activity, contraception, abortion, etc. All states have access for children to that. Some states have access to programs for dealing with drug addiction or mental health issues. So we have a history of allowing children to consent to things where there might be a problem with going through the parent.
And so just to make sure I'm understanding you correctly, this is kids who are under 18 but over 12 can go get the vaccine on their own. Under 12, they can't because it's not authorized for them.
Yes, exactly right.
Okay.
That's exactly right. So you can empower the kids to get the vaccine. In fact, in California, we already empower kids over 12 to get 2 vaccines without parental consent, that hepatitis B vaccine and HPV vaccine. It's part of a packet that was designed to protect children that were sexually abused by allowing them access to treatment. So we already have a precedent for allowing children over 12 to get vaccine without parental consent.
Right.
So that's one thing. The other thing you can do is, as you said, use a mandate to push the parent into allowing the kids to get the vaccine. We have a long history of school mandates. They're constitutional. There's a long jurisprudence that says that they're constitutional. We could add COVID-19. It's a political question. Are we willing to go there? And it's a policy question. Is it a good idea?
Wow. Okay, but legally,
yes,
it is allowed so long as, the vaccine is approved. In this case, does the FDA approval status, the emergency use authorization, does that matter?
It's the same question. Because the law is a federal law, it would apply to states, employers, and university on the same terms. So it's again a question, how do we interpret it?
Okay.
And right now, as I said, it's probably leaning to you can do it, but it's still not certain.
Yeah. I want to go in a slightly different direction here. I recently walked along with a vaccine outreach effort in the Tenderloin where people could get a shot right then and there on the spot, no appointment or anything. In a few hours of that shift, they administered 23 vaccines, and this is just in a few blocks. And they do something like 10 to 20 shots a shift even now. Some people were definitely not interested at all. But others were saying they couldn't get away, they couldn't get an appointment, they couldn't get to a vaccination center. I mean, these are people who spend, time in the city or live here. Some of them are homeless, some of them are engaged in street trade. Are there exemptions for simply not being able to access the vaccine?
So in an ideal world, access is a precondition to mandates. California did the things that sound like they're giving access, which is, for example, we have a law that says that your employer has to give you 4 hours of paid leave to go get the vaccine.
Right.
But as you're so nicely demonstrating, there's
your employer is a drug dealer, then you're not going to get 4 hours off.
and even if the employer is not a drug dealer, then they might not tell you. They don't. There's nothing in the law that says
Yes.
they have to go tell you. You may be worried about repercussion, even if it's your right. Not everybody can stand on their rights. So as you're pointing out, even before we get to mandates, the first thing we need to do a concentrated effort on, and it's not an either or. A lot of people who aren't vaccinating aren't in the situation you're describing. They just choose not to. Right. So we need to bring the vaccines to the people. That's crucial. And I'm really glad to hear that there's this effort. We need to bring the vaccines to the people, and we need to, in the back, also consider what are our options for people who have vaccine brought to them or have access and still aren't taking it. It's kind of both. Yeah. And we do also need, as a third part of this approach, we also need to address people's legitimate, reasonable, or even less reasonable, but real concerns about the vaccine by giving them honest, full answers. That's all crucial.
Yeah. Slight deviation from our conversation about employers. Recently, a group of bar owners in the city voted to require proof of vaccination or recent negative COVID test to enter a bar. I think I know the answer because these are private businesses, but legally that's allowed, right?
Yes. Okay. No shoes, no shirt, no vaccine, no service. That's legal. There is a limit from the American with Disabilities Act for people who really medically cannot get the vaccine.
Right.
You need to accommodate them. But as we saw with the masks in stores, that doesn't always mean giving them the same access. You may want to give them services under special conditions.
So glad that you brought up masks because that has been a topic of conversation. If we were still using the color tier system of transmission, most of the Bay Area would be in the most restrictive purple tier right now, but we're not. And Bay Area health authorities and the CDC have now kind of come back from, allowing people to take off the masks to recommending wearing masks indoors in public settings, regardless of vaccination status. It seems that we may go back to having a mask mandate. And to me, that seems like governments can mandate that everyone behave in certain ways in certain public settings. But could a mandate like that be done for vaccines more broad? Like everyone must get vaccinated to participate in public life.
So the jurisprudence on this says that government can impose reasonable vaccine mandates. As you can already read, there's a bit of question of what would be reasonable. So, for example, during the 2019 measles outbreak, New York imposed an MMR mandate on everyone 6 months and up, New York City, not the New York State, on everyone 6 months and up in certain neighborhoods that had high rates of measles. And the penalty was a $1,000 fine. Wow. This was challenged in court, and the court found that reasonable because it's only in the highly impacted neighborhood. It's a fine that's not low, but not in the many thousands. So again, it's a high fine, but we're not throwing people in jail. So the court found that was reasonable. So the question really will be, the devil will be in the details or something like that. The more targeted the vaccine and the lower the penalty, the more chances a mandate will be upheld. So the more targeted the mandate. A statewide mandate with a 3-year jail sentence is much less likely to be upheld than a high COVID-19 area mandate with, let's say, $300 fine.
Okay, well, we are running out of time, and I know you have to go. I want to give you a chance to add anything else about vaccine mandates, et cetera, that I didn't give you a chance to talk about that you just want to say.
I just want to say that in the background here is the anti-vaccine movement, which has been preparing for this fight for years and has been mobilizing since at least March 2020 to scare people of COVID-19 vaccine and to give them the tools to fight any mandates. And they've been behind some of the lawsuits. They've brought some of the lawsuits and have given arguments to other lawsuits. So there is an organized, well-funded effort here also on the other side. It's not as well-funded as government, but it's not the opposition is partly organic, Many people will have real concern, but it's not all organic. There's also a push to misinform people and to mobilize resistance to public health.
Oh, I'm sorry, but I have to ask, do you
Please.
know who's funding it?
I know some of it. So, for example, one of the organization, Informed Consent Action Network, is funded by a wealthy couple from New York, the Celts. American frontline doctors, which came on the scene in support of HCQ and are now bringing a number of lawsuits on this, seem to be receiving money from some conservative think tanks. I'm sure there's a lot more than that I just don't know.
Right. Wow, fascinating. Dorit, thank you so much for your time.
Sure.
I really appreciate it. That was Dorit Reiss, a law professor at UC Hastings who researches the law around vaccines and vaccine mandates. I'm Laura Wennis, and you've been listening to Civic. Before I let you go today, at the Public Press, which is Civic's parent organization, we've been working really hard during this pandemic to pursue angles we're not seeing much coverage of elsewhere, or to take a more systemic look at the issues that are surfacing in the headlines. The San Francisco Public Press is a nonprofit, and we're inspired by the public radio model. That's the idea that people who are able to support the work that we do so everyone can have access to it without paywalls or ads. If you think we're onto something, we'd very much appreciate if you could show your support. You can do that by going to sfpublicpress.org/donate, or by helping us get the word out about this show. Subscribe on whichever podcast platform you use, or leave us a review. It really does help, so thank you.